Non-communicable diseases are a health concern in Uganda, accounting for an estimated 33 and 41%.
It was found that the number of persons with diabetes in Uganda is 3%, which means out of every 10 people, 3 people will have sukari. You may think 3 is a small number, but that is really quite. 3 out of 10, 30 out of 100. Now this prevalence, this rate is the same, both in the villages and in towns. Sometimes we would think maybe diabetes or hypertension is in the places where people are in town, they are driving cars and things like that, and they are working in offices, but it is the same as, it is equal, both in urban and rural settings.
An epidemiologist, Dr. Geoffrey Kabagambe Rugamba, notes that non-communicable diseases have overtaken infectious diseases in causing death.
You may also have heard that recently the number of people who have lost their limbs, their legs, for example, is also on the increase. Because diabetes affects the blood flow, how blood goes to the lower limbs, and eventually that part dies off. So the doctors will tell you now, the only way you can avoid the further spread is to cut the limb.
Lead contributors are cardiovascular diseases, cancers, diabetes and chronic respiratory illnesses. This was during the 18th graduation ceremony of health workers, Medicare Health Professionals College in Mengo, Kampala. The Deputy Executive Director of the Uganda Health Professionals Assessment Board, Joseph Agondwa, urged them to target professional development to respond to the increasing disease burden.
The level of knowledge and skills you have so far acquired in the health field is just but a tip of the iceberg. So therefore, there is a lot for you to learn in the world of work. So be ready for continuous professional development. Those opportunities are out there. Take them. So be ready and make consultations when you are not certain about performing certain procedures. Even the doctors you have seen who have worked for many years, sometimes they are confronted with the patients where something is strange. He has to consult the colleagues.
From the TVET Council, the Senior Manager for Accreditation, Winston Abanaitwe, said all TVET institutions need to fulfill its mandate under the new legislative framework.
We have been training people in a fragmented way. You would find each training provider has their own menu, they train the way they want, and then they are not coordinated. That we shall be having national curriculums, we will not be having institution-based curricula. What that means is that the grading of a graduate here should be the same grading for a graduate in another region in Uganda. And so when you go to the world of work to apply for jobs and create your own clinics and medical facilities, it becomes easy for the public to believe in you because we have graded you on a level field. And that is what we're intending to do. And the Allied Health and Medical Professionals Assessment Board is already in place. Joseph will talk more about their mandate, and they will do exactly that. So the above that I've talked about require of us, especially as management and administration of the college, to transform our structures. You must have the structures that will liaise and collaborate with the industry or the employers.
The college principal, David Kansime, called upon graduates to uphold professionalism in service delivery.
Remember, skills will open doors for you, but compassion will keep those doors open. The country needs your expertise, integrity, and innovation. As you go out, please carry the spirit of Medicare Health Professionals College, service above self, professionalism above convenience, and excellence above excuses.
I swear to fulfill to the best of my ability.
The graduates took oath of allegiance to the noble health profession.
And as for now, as I've graduated, I'm going to make sure that I close the gap in the health sector of our Uganda. I'm going to make sure that I'm going to help out many people to educate them on the preventive measures.
I want to say that we have achieved as a group, because I didn't attend as a person, but we achieved as a group, as a class, as an institution. So Medicare Health Professionals Institute is such a mighty institute that has given us the basic knowledge to serve the nation, to give the knowledge that we attain as we are done. So we implore each and every one who wants to join the health sector to come. If you have the needed requirements, come and we serve the nation with diligence, competence, knowledge. Above all, it is God.
Like a government should create more health facilities and create for us spaces where we can at least also be put in that sector as clinical officers and be considered. And also, my humble request to the government would also to regulate the private sectors or private institutions so that they can put maybe a certain amount of money a clinical officer should be receiving in those private facilities.
We remember that there is art to medicine as well as science, and warmth, sympathy, and understanding may outweigh the surgeon's knife